Hi, my name is Vivi. I'm a registered dietitian in the Child Care Health Program with Public Health, Seattle and King County. I'm here to talk about finger foods. Yay! Before we talk about finger foods, there are some safety steps to prevent choking. Make sure while eating, children are supervised or sitting upright. They should avoid distractions and are removed from their table if they begin to fall asleep. Usually between 6 to 12 months, babies are ready to swallow foods, and it's important to be careful when introducing foods for the first time. Babies should easily accept foods without gagging and grasp finger foods themselves. To reduce the risk of choking, here are some examples. First of all, we need to cut the food that is only 1/4 of an inch or smaller for babies that are 6 to 12 months old. Here are some examples per food groups. Proteins like eggs, tofu, vegetables like carrots and peas. Another example can be cooked sweet potatoes or greens, kimchi. Some fruits I have here: mangoes, grapes, another great option. Watermelon, so colorful. And another beautiful fruit, blueberries. And then we also have grains like quesadillas, for example. And then we can also offer whole grain, O-shaped cereal, or we have other options like anjero or leho, and some dairy products like cheese. They can be grilled cheese, they can be a small cut cheese sticks, or they can be cube cheese. Think about serving a variety of different foods and colors like we have here to make it fun and nutritious.